Thanks for being with me today. I'm Dr. Nick. We're introducing the lumbar spine and just some basic structural anatomy. So if we take a look here at this model, we can see that the lumbar spine is made up of 5 vertebrae, L1 through L5. There's discs in between each of these, and this helps us remain upright and supports compression loads. You can see this is going to mimic the spinal cord, this vertebral foramen. It forms a canal between the body of the vertebra, and that's where the spinal cord runs until about L1, L2, which is where it stops, and then it becomes the cauda equina, which is just further nerve extensions that go all the way down into the sacrum region. Some other important structures to look at are going to be the IVF, intervertebral foramen. That's the hole where the nerves actually come out of the spinal cord and run to feed their structures. So this is also a common site where we can get degeneration and nerve complications. So that's the IVF. On the back side here, you can see the facet joints, zygapophyseal joints is what they're called, the Z joints. These help us mostly with flexion and extension and a little bit of rotation. So that's going to be the joints there on the back side. And they're surrounded by a ligamentous capsule that can also become a site of injury. So you may have heard of facet syndrome, and we're going to talk about that in a future video. Lastly, the main thing we want to talk about with this is the curvature of the lumbar spine. So you should have kind of a nice reverse C curve, a lordosis, and that's just going to help with supporting our weight again and transfer of load and balance in spine. So that's the lumbar spine, common things that we look at, and stay tuned because we're going to get into the abnormalities that we commonly see. We'll see you next time.